Well, good morning, everyone. I'm extremely nervous. Bethan's a very hard act to follow. And now I admit to feeling very, very nervous when Mark asked if I would speak at conference. I've never done anything like this before, but here goes. How did it all come about? We planned a trip to the Far East in February 2018. And we needed to have some vaccinations, travel vaccinations, and went to see our practice nurse. She started by explaining what she thought we should have, and I was given MMR, tetanus, and polio. That's the one she thought we would need. The MMR, we were told, would have to be given in 2 doses, and she said, "Now you might get a little reaction to this one. It might just give a little bit of redness around the site of the vaccination." And so 3 or 4 days later, my arm was really hot and red. And so I rang her and she said, "It'll go down and let me have a look at it when I have to give you the second vaccination." So we went back 2 weeks later and she said, "I'm not going to give you it." She said, "You probably had measles when you were a child and you're carrying some natural immunity to this now. You don't need it. All I would say to you is when you go away, be a little bit more careful." She said, we all like to think that we're being very careful about our personal hygiene, washing hands, making sure that you're not eating and drinking from dirty utensils, but just be a little bit more wary. And she said, "You should be okay." So off we went, and then I'd noticed a little lump on the side of my neck. Wasn't very much, but just noticed it when I was putting cream on. And I said, "I wonder what it is, this," and decided I would go and see the GP when I got back from holiday. And he said, "Oh, yeah, there is a lump there." He said, "It's a lymph node. Don't think it's anything to worry about. We'll go down," he said. "It's probably connected to those vaccines you had." And he said, "Come back if it doesn't go down." But it did. It went away. And then in the June, we had tickets to go to the Royal Horticultural Society show at Chatsworth. And a couple of days before we went, I had a really nasty tummy upset. And I thought, this is going to really make me feel a bit weak. So anyway, we went off to Chatsworth, and I can't remember anything about the show at all, apart from looking from bathroom to bathroom, because I was just so ill. On the Thursday, we came home and went back to my doctor's, and I collapsed in the doctor's surgery. And I was admitted to Scarborough Hospital because I was so dehydrated. And they diagnosed that I had Campylobacter. And I was kept in overnight so they could put extra fluids in. And they took some blood tests. When the Campylobacter went away, the lump was still there on the side of my neck. And I sort of thought, now, is this going to come up every time I have a little bit of illness or not? So went back to see the doctor, asked for an explanation. And he said, "I'm beginning to think there's a little cyst on the side of your neck there." He said, "I can drain that, but before I do, will you just pop up to the local hospital and have an ultrasound?" He said, "Go now, I'll ring them." He said, "You go now." And so we went, and it wasn't a radiologist I saw, it was a doctor. And he sort of started feeling all the way around my neck, back and front, not just where the little lump was. And I said, "What are you looking for?" He said, "I think you've got more raised lymph nodes than you know." He said, "There's quite a few." He said, "I can feel at least 4. Will you go and have a chest x-ray?" I said, "Yes." So, "Go and do it now. Have a chest x-ray now." So we went and had that done. That was clear. Nothing wrong there. Right. I know. We'll send you through to Scarborough, and you can go and see a maxillofacial surgeon, I think he was called. He might want to do a biopsy. So we waited, I think, 10 days for the appointment and went to see him. And he put a camera down my throat and had a good look around and said, I'm not doing any biopsies. He said, there's nothing wrong down there. He said, everything looks clear. Nothing wrong. He said, but we'll do some more blood tests. And whilst we're waiting for these blood tests to be done, we'll refer you to have a CT scan. That was horrible. We got an appointment to go for that CT scan, and it was 7 o'clock in the evening was the appointment. And we had to be there an hour before so that I could drink some horrible tasting fluid. And I had to drink a litre of this stuff. It was repulsive. I had to sit and drink all this. And got through to have this scan. And I said to the person doing it, just more for something to say, I said, are you able to tell me what you're looking for? And she said, oh yes, she said, we're looking to see if there's any more cancer anywhere else. And I thought, cancer? Nobody had mentioned cancer to me. And, can you imagine the reaction? I was just terrified at this point. Nobody had said anything about cancer. I got a little lump on the side of my neck. That was all. Anyway, the CT scan was thankfully clear. But I then got an appointment to see the haematologist. And we see her in Scarborough, a wonderful Dr. Monroe, and our clinical nurse, Vicky Dixon. She's wonderful. And they said at that point they thought it might have been lymphoma. But further investigation showed that there's no lymphoma there. But, always a but I did have CLL. And I'd never heard of CLL. I had no idea what CLL was. The only type of blood cancer I'd ever heard of was a myeloma, which Tony's father had had. And that was the only thing I'd ever heard of. But when they said it was leukemia, I thought, that's cancer. I've got cancer, I'm going to die. And I said, am I going to die? And Dr. Monroe said, well, one day, yes, but not necessarily immediately. She said, you will, one day. She said, but you're more likely to die with the CLL, not of it. Which helped a little bit, but I still had it. So I now sort of think about my CLL as a condition. I don't think of it as a disease. I've tried to put it to the back of my mind, and I can keep it there most of the time, except when I'm due to go for blood tests or when I go to see Dr. Monroe. And then it comes to the fore, and then I'm scared until I get the results from them. My white blood count when I had the Campylobacter was 10.9. It's now 46.6 at the last check, which I understand isn't bad, I'm told. I've come to terms a little bit more with it now, and I can try to enjoy life as much as I can. We're extremely busy in Bridlington. We do quite a lot with the University of the Third Age, and we garden, and we take as many holidays in the colder months when we're not gardening as we can. And we do lots of things. As I said, I live on the East Coast in Bridlington, and I would like to start or get involved with a support group if I can. I would need some help with it. I know absolutely nothing about starting anything like this, and I would need some help with it, but I'm keen to do so. It's always been my way that if anything at all has affected my life, I want to know as much about it as I can, which is why we said we would come here today. I knew absolutely nothing about it. Want to talk to as many people as I can to find out about it and deal with it. So, thank you for listening to me ramble on. I'd just like to pass you over to Tony now. He's going to tell you how he dealt with my diagnosis. We've been married for nearly 40 years, and he's my absolute rock and my support, along with a wonderful family and friendship group. So I'll just pass you over to him now. Thank you very much.
Hi, I'm Tony, Alice's husband for the past 40 years, as she said. going on 68 years of age, retired myself at 64. Okay. And that's better, I think. Yeah, so I'm just going on 68, retired myself when I was 64, and we enjoy life to the full, do what we can. As Alice mentioned, my father also had a blood disorder. And for many years, actually, we used to take him to the hospital roughly once a week. And he used to have a full blood transfusion. And although this went on for years, he was the strongest of everybody. Always happy, never let it get him down, always laughing, joking, soul of the party. And when we finally lost him when he was 80, it wasn't actually through his blood disorder, it was some other thing that he'd picked up. But even on the night that he died, he was still looking forward to the future. He was so optimistic. And he said to me, I think I'm not going to see through tonight, Anthony. And it's a shame, really. I still thought there were 4 or 5 years to go. And he was always looking ahead. And it's one thing I learned from him is that you never, ever let yourself get down. Always look forward to the future. Always be optimistic. Never be worried about anything. And that's the way that he was, and that's what he taught me. So when Alice first went for a diagnostic for the lump on her head, I just thought she was going to end up and have a cyst drained. So I always used to take her to the hospital, drop her off, and go and sit in the supermarket car park, because I never paid for the parking ticket in the hospital. So when she finally rang me to say, you can come and pick me up now, she's normally very chirpy. Right, I've done, you can come and pick me up. But this time I knew from the tone in her voice, I thought, that's not her usual self. So I thought, well, whatever it is that's upset her, it won't upset me. She'll just see me as normal, chirping her up, well, okay. So she's saying, I've got to go for more tests, got to do this, got to do that. And I was saying, well, okay, you just take one thing at once, get through one, till we get through the other, till we get through the other, until we finally get your diagnostics, get sorted out with what you are. So I knew it was difficult for her at that point because she couldn't see anything into the future at all. Everything she did, she was trying to do her best, but she was always thinking there's nothing in front of us. We'd got holidays booked and all sorts, but I wouldn't mention the holidays to her. I wouldn't mention anything about the future because I knew that would upset her. So it was just always about what we were doing now and filling in the next hour, what we're doing now. And then eventually we got the diagnostics. And I thought to myself, well, that's actually a bit of a sigh of relief. She's only got CLL. I thought we can live with that. Because I didn't know what else, it could have been anything. So I thought, right, from now on, I can now start talking about the future. Start pushing her towards, right, we can now go on the holiday, we can go to Cape Verde, Lanzarote, Portugal, all the things that we got booked up. And I was giving her positivity all the time. Look forward, look, what's next, what's next, what's next. And she started to come out of herself, get more happier, chirpier within herself. And we started looking forward with more enthusiasm. She became more confident, got us put into a positive frame of mind. Now, personally, I would never show her any doubt from myself. Because if I looked as though I was unhappy with her, she would feel guilty and get upset herself. So all the time, I'm geeing her up, just like my father would have done. Never ever do I show any remorse, upset, nothing. Just guide her to the future, happiness, going forward. So, since then, we've been enjoying those holidays to the full. The future's now holding no fears. Life is normal. That's to say, we're very busy and active. We always have been. And I believe the future, and with the advances in the medical world that are really going on now, that that will make things more beneficial as the years go by, because I think that the medical world really is advancing quickly. And I honestly believe that when Alice eventually leaves this world, in her old age, it will be with CLL and not because of it. We will always, and I will always remain focused, happy, and looking forward to everything, optimistic, just like my father taught me to be. I will never let it get me down, and I'll try my best never to let it get Alice down. And that's all I need to say today. Thank you.